After leaving the hospital, caring for your surgical wound at home becomes one of the most important steps in your recovery. The incision that was made during surgery is beginning a complex healing process, and your everyday actions matter more than you might think. First, always begin with hygiene. Before you touch the dressing or even walk near the wound area, you must wash your hands thoroughly with soap and water. No shortcuts. A clean work surface, fresh gauze or bandage supplies, and a calm environment are your first lines of defense. Remove the old dressing carefully. If it sticks, moisten it with a little sterile or clean water so you don't damage the tissue beneath. Once the old dressing is off, inspect the area for any signs of trouble. Increased redness, swelling, unusual drainage, color changes, or smell. Then you gently clean the wound area. Use mild unscented soap or saline solution and lukewarm water. Avoid using aggressive chemicals like alcohol, hydrogen peroxide, or iodine that may damage fragile healing tissue. Pat the area dry with a clean towel. Do not rub. Next, apply a new dressing as instructed by your surgeon. Ideally a non-stick pad secured with surgical tape. And always ensure the dressing is clean, dry, and intact. If the wound remains dry and your surgeon approves, sometimes you may leave it uncovered after a few days. But any saturated or wet dressing must be replaced immediately. Protecting the wound means you must avoid soaking it in baths or hot tubs, and avoid swimming until fully healed. Showers are better. Keep the incision out of direct heavy water flow, and after showering pat dry and apply fresh covering. Clothing matters too. Wear loose, breathable fabrics that don't rub or press the incision. Avoid tight waistbands, straps or zippers near the wound site. As you move about at home, be cautious not to stretch, pull or press the skin around the incision, especially if the surgery involved the chest, abdomen or back. Lifting heavy objects, sudden twisting movements or intense coughing without supporting your chest or abdomen can stress the wound and delay healing. Nutrition and lifestyle support wound healing. Eat protein-rich meals, hydrate well, and if you smoke, stop now. Smoking restricts blood flow and slows healing. Monitor your wound daily. Note any increase in drainage, change in color of the fluid, yellow, green, or foul smell is bad, red streaks away from the incision, increased warmth, new or worsening pain, fever, or chills. These may signal infection, and you should contact your healthcare provider without delay. At all times, follow the instructions given to you at discharge. How often to change dressings, when to change the tape, when to remove stitches or staples. Never remove them yourself unless told. As days progress into weeks, you may find you can skip dressings if the incision is fully closed and healing well. But keep checking. Your body is going through the phases of healing. First inflammation, then tissue rebuilding, then remodeling. The scar tissue is getting stronger all the time, but for many weeks it remains vulnerable. Until your doctor clears you, avoid soaking the wound, avoid high-impact exercise or heavy weights, avoid direct sunlight on a new scar, avoid applying lotions, powders or creams unless approved. Sleep and rest matter. Lying in a comfortable position that avoids pressure or friction on the incision helps. Keep a pillow handy if you cough or sneeze to support the area. If you must cough, contract your abdominal or chest muscles gently and hold a pillow against the incision to prevent pulling. Also avoid sudden weight gain or fluid retention that may stretch the skin and wound area. If you notice your wound edges separating or the scar looks gaping or the skin around looks pale or dead, this could be wound dehiscence. Seek medical advice immediately. At around week 1 to 2 your energy may improve, you'll feel more like yourself, and if healing is uncomplicated the dressing may be changed less often. But remember, healing is still working beneath the surface. For many operations, complete internal healing of the layers beneath the skin takes several weeks to months. The skin closure may look fine, but underlying tissues are still recovering. Therefore, continue your careful wound care routine. Avoid pushing too hard, and incorporate gentle movements and walking rather than jumping into full physical activity. Family and support persons play a role. Help ensure the wound area stays clean, remind you of dressing changes, observe for warning signs, and help with daily tasks until you're safely independent. At any point if you experience increased pain at the incision, fever, chills, foul smell or heavy drainage, red or streaking lines, swelling of legs or feet, or if the dressing becomes saturated with blood or fluid, stop what you're doing and seek medical advice. In short, your surgical wound is healing, but you must treat it with respect. Clean thoroughly, dress appropriately, protect the area from strain or contamination, monitor for warning signs, nourish your body, rest well, and let your body do what it needs to do, rebuild. With consistent, careful home care, you'll support the process of healing, reduce risks of infection or complications, and help ensure that when you return to full activity, you're starting from a strong, safe foundation. Thank you for watching. Stay attentive, stay gentle with your body, and subscribe for more heart health and post-surgery recovery guidance.